In health news this morning, November is National Hospice Month. Well, hospice care can be a very difficult topic for some to talk about. It is important to have these conversations. Dr. Bay from Spectrum Health Medical Group is joining me now with everything that you need to know. So good morning. Thank you so much for being here with us.
Well, thank you for having me here.
Absolutely. So why is this such a difficult topic for families?
You know, it's not that hospice itself is a difficult topic for families to talk about. It's really end-of-life care that is a challenging topic. And part of this is because historically medicine has been focused on the cure and fighting diseases. And that's what we've always done. And even though we've made some great advancements, we can't eradicate all diseases.
Right.
So as diseases progress, and then hospice gets called in, and it's kind of seen as a giving up, a defeat. And that's really not what it is. Hospice is about living well till the very last moment. And you know, at Spectrum Hospice, we really focus on that. You know, we look at what families and patients fear and what they hope and how we can support them.
Sure. So what are some of the benefits involved with adding hospice care?
You know, hospice is a complex and very compassionate care model. You know, with hospice, you get a full multidisciplinary team that comes in and really gets to know the patient and their families, what their values are, what's important to them, and from that, we create a customized care model. So there's not a one-size-fits-all. You know, and you get a full team, like I said, and the goals are focused on the comfort, quality of life, understanding that there's no cure for the illness. And in that, we make sure that patients are as pain-free as they want to be, as it's possible. We provide them emotional and physical support, and even end-of-life care planning.
So what are some of the signs that someone is probably ready for hospice?
Gosh, you know, we used to think of diseases like cancer as the terminal illnesses, but there are many diseases now like dementia, heart failure, COPD. These are all diseases that don't have a cure. They can be managed. But when you see that your loved one is not wanting or maybe not tolerating the treatment, they're becoming weaker, they're spending more time not doing the things that they want to do, we find that that's a really good time to have hospice come in. Or even when caregivers are confused about how to support their loved ones, they're not sure what to do for them. You know, there's been a couple of studies that are quite remarkable. One of them was talking about how patients who get hospice care actually live longer. They live up to 3 months longer in diseases like heart failure. And another study, which I also love reciting, is about caregiver grief, that they found that patients who received hospice care, their caregivers had less grief after their loved one passed away. You know, so hospice really provides a support not just to the patients, but their families and their loved ones. So great benefit.
Yeah, absolutely. And as the patient, what kind of control do they have once hospice is called in?
Gosh, you know, when we talk about quality of life, we know all of us really want to have say in what happens to our life. So at Spectrum Hospice, we really focus on the patient. So the care plan is made with the patient in the middle, the family's input, and then with the expertise of our multidisciplinary system. So really, the patient does have the control. You know, we try to listen to them at every juncture. They are participating in the decision making, and that continues all the way till the very end. So the goal is to give them control, to give them the autonomy and the dignity, and we just provide the support.
Yeah, and that kind of leads into the next question of what people should kind of expect from the beginning, I guess, into the end when hospice is called in, to kind of how they do that transition through the whole process.
You know, and there's no two individuals alike, right? So there's no two families alike, and therefore there's no two care plans alike. So you know, when you get Spectrum Hospice in, sometimes, you know, it is a large team. You have a physician, a nurse, an aide, social worker, volunteers. We have some amazing volunteers that do things like light housekeeping, caregiver relief, my life story. We also have music therapy and pet therapy. And I have to tell you just a really brief, I went to go see one of my patients who had advanced dementia. And when I walked into her room, you know, she was having a lot of agitation, as in why they called me in. And I didn't hear anything, and I walked into her room, and there was our harpist playing the harp, and this patient was peaceful, comfortable, relaxed. And I stood at the doorway for about 10-15 seconds just in awe of this care. So really, our team looks outside the box to look at what provides the patient and the family with that kind of comfort so they can spend the last moments or all the moments of their life doing what's important to them.
All right. Well, if people need to reach out to you and your team, as you mentioned, who likes to kind of think outside the box and really take everybody as an individual, what's the best way to reach out to you guys?
You know, we have a website that you can see on the screen, and or you can just give us a call. You know, even if there's any questions and you think, I'm not sure, don't hesitate to call. We'll be happy to help in any way that we can.
Okay. Well, thank you so much. Once again, all the information is right there on your screen. You can go online to find it or just reach out and give them a call. Thanks for stopping by, Dr. Bay.
Thank you very much.
Absolutely.